All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. Consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the special trustee meeting July 28, 2020, and a check report July 9, 2020 through August 8, 2020.
I move we approve the consent agenda, items A and B.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon to approve the consent agenda as it was presented. Roll call vote, please.
Gassford,
Yes.
Hannaford,
Yes.
Lawrence,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown.
Yes.
All right, first item, or next item, is the CEO's report. Candace?
All right, I don't have much really. Dr. Galbraith, which is spelled wrong by the way, his clinic is getting busier, which is good to see. Our employees are now able to complete the full onboarding process through Paycom, which is the software that we use for payroll. So they're able to log on and do nearly everything that we need them to do remotely, which is really nice to have all of that online now. The True Bridge project is in full swing. I feel like that's really moving forward better now. We've kind of, it's been a struggle, as any new implementation is. We didn't expect it to go real smoothly at first. We had a call today, and I think we all are feeling better about where we're at in that process now. So we will start seeing, they're working on the accounts to make sure that everybody has gotten a bill in the mail and knows what their obligations are, and very soon we will start turning people to collections that maybe have not had that experience before, and we will pursue those potentially with legal action if needed in the future. So that's kind of where we're at with True Bridge. They are going to be on site in 2 weeks to do an on-site visit and troubleshoot any of the processes that we need to at that time, and I'm pretty happy with where we're at. Any questions on True Bridge? Moving on to the VersaBadge project is live, and if Dr. Oh, look at you, all compliant and everything. He's got his little badge on. That's what tracks his downtime. Each provider in the ER tracks their downtime, which brings us more reimbursement with our Medicare cost report. So basically it helps cover their downtime costs, and that's what that's for. So we're excited to get that finally kicked off. We kind of ran out of time today in finance meeting talking about our door security project, and we will either have to have a special meeting or pick that up on the next finance meeting. We need to replace some of our workstations on wheels. That's what the nurses use their laptop sits on that, has their med cart with it, and we'll be using COVID funds to do a replacement of those. Probably, I don't know, there's probably 4 to 5 carts or 6 carts that are needed. UV lights, we didn't get to that today either. We ran out of time. Business overall has been picking up. This whole COVID thing is, today I didn't get the final total on patients registered, but I knew we were starting the day off with around 190 to register, and then we had, I believe, a group of 53 walk in. So that's pretty taxing on on the staff, registration and nursing staff to get all those done. But they made it through, nobody died, so we're happy about that. Northwestern nursing students will start returning to their clinicals soon. Regina and I did a recruiting visit to the senior nursing students, provided lunch to them last week in hopes of getting some of those interested in joining us upon graduation. Upfront collection stands at just over $15,000. That's about half of what we're used to. It hasn't ever returned to that since COVID, so hopefully we'll be working towards getting back to around $30,000 for upfront collections. We talked about those things. That's outreach clinic. I have been, Dr. Schmidt, Dwayne Schmidt, a cardiologist who Dr. Self uses a lot, contacted me and is interested in doing a clinic here. And I have sent him a contract and look forward to getting something, an outreach clinic with that cardiologist. It may not be Dr. Schmidt particularly, but somebody from his group.
And where's he from?
Oklahoma City.
Oklahoma City.
I believe that's an independent group of cardiologists. They're not affiliated. That's it. David Camp. We all can't wait for David to join us. I have proved that I'm a terrible HR person. David Camp, our new HR director, will be joining us shortly, September the 1st. He will start, and we look forward to getting him on board and helping us with many of our projects that we've got going on. Does anybody have any questions for me? Did I miss anything?
Any questions? If not, I entertain a motion.
Make a motion to approve and accept the Share Medical Center written report for August 25th, 2020.
Second.
I have a motion.
Can I retract that for a second? Can I say something else? Please.
Sure.
I just want to, you're going to start hearing it. Dr. Self will be back in his clinic on November the 2nd. And so I did get to talk to him. He FaceTimed me today, and we got to talk for quite a while. He'll be back in his office on the 2nd, and Steve Madrid will then join Dr. Galbraith in Suite A down there. So looking forward to that. Sorry, I forgot that.
Okay. You guys still good?
Good.
All right.
You good?
So we have a motion by Dr. Hannaford, a second by Jay Randalls, to approve the Share Medical Center written report for August 25th, 2020. Roll call vote, please.
Hannaford,
Yes.
Lawrence,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Casper.
Yes. All right. Thank you, Candace. Next is the CFO's report.
Okay, you probably already noticed in your book that behind the CFO tab, there are no financial statements. Didn't get those done for July yet. We're close to being done, but we were doing pretty good. It was one of those good months, bad months. The good part is that Chris Lauderdale was hired as CFO. So I've got somebody to help me now and to train. The bad part is the training takes time, kind of slows the process down, but it's definitely worthwhile because Chris is catching on very quickly. He's obviously a very sharp person, and he's going to be a really good CFO going forwards, I feel. So we're doing pretty good, and then we discovered some issues with TrueBridge that we didn't have some revenue reported the way it should have been. So that slowed us down. It took us probably 2 or 3 days to figure out exactly what was going on and what that adjustment had to be. The problem with accounting, you make one adjustment, it leads to another, and it's just kind of been that way. But we plan on having those financials done for July by the end of this week, and then we'll jump right into August. The one thing that is in this packet behind the tab is, first page says Canon Medical Finance at the top of it. This is the company that is going to finance the lease of the CT scanner. You actually reviewed that, you actually approved that in last month's meeting to go into a lease the way it was originally presented to us. Well, after we signed that intention, the agreement to enter into that lease, of course, then they got serious and wanted financial information, quite a bit of financial information from us, which I was glad to furnish them with. Balance sheets and income statements and cash flow statements and audited financial statements, interim financial statements. Of course, they had a lot of questions, and we got that all resolved, but I think because of the way things are in general, with the economy, with COVID out there, the uncertainty with that, the fact that we're in an industry that is very volatile and experiencing a lot of upheaval right now. As we all know, rural health is pretty precarious. So I think this leasing company said, hey, we want their business, we want to work with them, but we're going to make it a little better on our side. We're going to get more money up front, so they feel like maybe we're more committed to follow through with that lease and live up to the lease. So they sent back some changes. What they want is 10% of the cost of the equipment up front in the initial payment, which I have no problem with that. We have the funds in our sales tax account where we accumulate the excess amount of sales tax over the payment we make on our loan to pay off the bonds that we issued a number of years ago. So that sales tax pays that note, and then the rest of it we can use at our discretion. We like to use that to buy or lease equipment, and this is a perfect example of using money out of that to make that initial down payment and also help with lease payments going forward. So what we ended up with, if you turn back about 5 pages to page that says Lease Schedule number 01 at the top, they want, I'll just read what's in the agenda. They want an initial payment of $44,831.40. And then after that, there would be 23 payments for the lease only of $5,290.20 a month. Then for the last 48 months, we have a service agreement that you all approved at the last meeting that is still in effect. And we have 2 years of warranty with service agreements as part of the equipment. Then the last 4 years of the lease we're going to be in this service agreement, and we'll be paying the last 4 months 48 payments that are a combination of the lease payment and then the per month for the service agreement. And the total of those two amounts is $9,251.37 a month, and that will go for 48 months. So initial payments, 23 payments of $52.90.20, 48 payments of $92.51.37 adds up to a total of $610,571.76. And that actually saved us some money because by paying that money up front, it lowered the lease payments. So we're actually saving a little money, but we're having to front a lot more money up front.
So in the end, it's the same product, it's just changing how we're paying, and total payments will actually go down. We discussed that in finance, and we were okay with those changes. But we do need to amend the contract with them, so we will need to vote on that. Are there any other questions? Does anybody have any questions in regards to that, those changes? If not, I would entertain a motion about the amendment.
I'll make a motion to approve the amendment to Canon Aquilin Lightning 1632/CT scanner originally outlined in quote 140127-2 to change payments to an initial payment of $24,831.40 for 23 payments, lease payments only of $5,290.20 per month, followed by 48 additional payments, which is the combined lease and service agreement payments of $9,251.37 per month for a grand total of $610,571.76.
Second.
We have a motion by Dr. Hannaford, a second by Jay Randalls, to approve the amendment to Canon Aquilin Lightning for the 16/32 slice CT scanner originally outlined in quote number 140127-2 to change payments to an initial payment of $44,831.40 with 23 payments, lease payments only, of $5,290.20 per month, followed by 48 additional payments combined with the lease and service agreement payments of $9,251.37 per month for a grand total of $610,571.76. Roll call vote, please.
Lawrence,
Yes.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Casper,
Yes.
Hannaford.
Yes.
All right. Next item is discussion regarding use of COVID-19 stimulus funds to replace lost revenue and reimburse COVID-related expenses.
I think I might be a little short.
Steve,
You can have mine.
I still have mine from finance.
Here.
Here's a set.
I need to get Mary on.
Here you go.
I've got a couple more here.
I'm good.
Nobody wants to get
I
confused.
got my best t-shirts on, I'm good. Won't be so much. Leave me alone over here.
What's wrong?
So what you're looking at here is two handouts. One is for the hospital, one for the nursing home. And this is where I'm tracking the funds that we receive for COVID-19 related expenses and loss of revenue. And I show how we're using that, recognizing the lost revenue, recognizing the expenses, a couple of capital expenses that we made, and then showing the board how much money we have left in those funds. And on the second page of the one that says hospital, I might just point out that the way we're tracking income is comparing the current month of the current year, when COVID is here and affecting us, with the same month a year ago. And you'll notice on that bottom line that our revenue was down starting in February, March, April, May. In June, it was continued to be down. In July, it actually went the other way. We actually had a little bit more revenue this month than we did a year ago, which is an indication maybe the hospital's back where it should be and we're getting our revenue back. People are coming back to the hospital and having procedures done, and that's what we're all striving for. So that part's looking good. We're continue to have a fair amount of expenses. A lot of that is the cost of COVID testing. Probably 2/3 of that total cost is COVID tests that we purchased so far. And that continues to ramp up, it looks like. So, based on this, have a considerable amount of money there at the bottom that we can still spend. The board's trying to be good stewards of that money. We feel like we don't want to just buy things because we can. We want to buy things that we're going to use, that are going to benefit the hospital, benefit the community, keep our patients safe, and try to keep COVID out of the facilities as much as we can. So we're looking at a lot of different things, but that's where we stand right now. Nursing home doesn't have nearly the funds that we received. They're tracking a considerable amount of lost revenue. They have some expenses over there, not a tremendous amount of expenses, but they've already pretty well consumed the funds that were given to them. So I don't know where it's going to go from here. I guess nobody really does as far as if we're going to get more stimulus funds. It just depends on how long this pandemic lasts and how long we're in a national health emergency. And until we get out of it, I think they're going to have to keep some money coming to hospitals and other facilities that need it. I commend the federal government for, really quickly doing something which is so contrary to everything you believe when you hear federal government. They never act quickly, but they really got with it on this one. They had money out within a matter of weeks, and they really got the money out into the economy before they really had figured out how it was all going to work and how it was going to be paid back, if it was going to be paid back, what it was going to take to keep that money. They worried about all the details later instead of worrying the details first like they usually do. So, an example of government working, government in action, and government doing what they're supposed to do, protect the people. You guys have any questions on any of that? Like I said, as far as discussing capital purchases, we got a lot of things we're looking at. Some types of equipment, some building improvements. We're wanting to improve our door locks over here and have security cameras where we feel like we can really track people inside the facility. Catch people coming in that might have COVID, keep them out of the rest of the population. Things like that is what we're looking at, and we'll be keeping you appraised going forward.
Any questions? If not, thank you for your report.
That may be my last board report. Although I'll be here, I'll be, just to give you an idea going forward, I think from now on Chris can handle the financial part. I'm going to concentrate on the COVID funding and how we're expending that, and there's going to be an audit done on that federal program, so I'll be involved in that. So we'll kind of split up our duties. I'll still be helping him on projects, he'll be helping me, but we'll kind of divide things up going forward.
All right. Well, next item is Medical Staff Executive Committee. Chief of Staff, Dr. Lawrence.
All right, we had our Med Staff meeting on August 13th. Really wasn't a lot on the agenda that day. We approved the old minutes. Did any new business to go over other than discussion as a committee on medical side appointment, Dr. Stephen Danley DO to courtesy staff and Med Staff Executive Committee. That was passed. And that was really it.
Okay, so we need a motion on the reappointment to courtesy staff for Stephen Danley, DO.
Make a motion to reappoint courtesy staff Stephen Danley, DO.
Second.
Have a motion by Dr. Brown, a second by Dr. Simon to reappoint to courtesy staff Stephen Danley, DO. Roll call vote, please.
Randalls,
Yes.
Simon,
Yes.
Brown,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Lawrence.
Yes.
Okay. Anything else?
No, sir.
All right. Well, thank you.
You bet.
Next, Quapping. Do we have anything for Quapping?
Not really. The committee met on August 12th, and we continue to closely monitor the tasks and initiatives to see what additional improvements need to be made. Satisfaction surveys and department initiatives continue to be monitored to identify trends or areas for improvement. That's pretty generic. I promise it'll be better next month.
Okay. So under improvement patient care, first is the contract review.
All of the contracts were reviewed and compliant.
There's a validation calendar back there, if anybody has any questions about any one of the contracts. If not, next is the Dietitian Report.
What's her name? Ruth Ann was here to do a quality check on the dietary food service, and she will come and we will order a tray, just a random tray. It might be like 80 no salt added or a diabetic tray, and she will monitor that for temperature, texture, taste, all those things that you would want to make sure that you are serving to patients was a quality product. And those were compliant and didn't have any trouble with those. She does a quality report as well and logs that into our SQSS system, so there was no issues for discussion.
All right. Next, we have a series of policies. My first question, I guess, would be, are there any changes to these policies, or are these renewal approval of these policies?
Those are all renewal.
Okay, other than maybe the COVID-19
You'll
guidelines?
have an indication if it's new.
Okay. What about the COVID-19 guidelines? Is that something?
I think we've done that once before.
Right, we did that back in, is that just an update? Do we have to update this now every month?
I believe Amber has added some changes, like when we went out of, we changed, say, our visitation policy. We had opened back up where if you were having a surgical procedure or if you had an inpatient that, families could come see them, and then with the increase in the numbers, we don't allow that anymore, so that's probably, she's just
Okay.
updating.
Does anybody have any individual question about any of these policies? If not, it allows us to have one vote unless any trustee desires to have a separate vote on any or all of the policies. If not, I would entertain a motion to approve items 7C through 7K.
I make a motion to approve items 7C through 7K, routine policies and procedures.
Second.
I have a motion by Jay Randalls, a second by Dr. Hannaford, to approve items 7C through 7K as listed under improvement to patient care. Roll call vote, please.
Simon,
Yes.
Brown,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Lawrence,
Yes.
Randall.
Yes.
Okay, thank you. Next item is the Share Convalescent Home Report. Kelly?
July, we had
Just a slight reduction in average daily census. Our paid days went up versus May, but there's more days in, versus June, but there's more days in June, so that's that. We have probably in the last, and I know this isn't necessarily July, but in August we've been, had to focus a lot of attention on COVID-19. We have had some employees test positive, and then with the reporting requirements of the state, keeping up with that. And then testing of the total facility had been recommended, not required, but I got an email today that just now that CMS is going to require that all nursing homes do regular testing of their staff and offer the same testing to the residents on that same basis, but no, it doesn't sound like they're going to require that. I'm still looking for more guidance on how we implement that. I do know that we are expecting to receive our own testing apparatus and supplies as part of the CARES Act stuff that's going out to all nursing homes across the country if they've got a CLIA agreement in place. And so don't ask me what that stands for, maybe somebody else would have to tell you, but it's a lab thing. But we have, today we completed our third facility-wide testing. Today we tested about 120 employees. All of those tests were processed here in our lab at the hospital, and they were all negative. We're doing a pretty good job feel like we're doing a pretty good job of knowing when somebody tests positive, who all's been affected by it, and mitigating, further spread. And but we're doing, I think, pretty good to not have any of our residents test positive. I was talking to one of the people from the state called today to check on us, and I was talking to her. I said, I don't know if it's that we're doing things so great or it just didn't happen yet. So we're hoping that we're doing things good. And I feel like overall we pretty well are. We are working on trying to figure out the best way to get people in touch with their loved ones. Since March, basically nobody's seen their families. Zoom meetings are, I guess an okay alternative, but that's not the same. And we are experiencing declines in function, declines in emotional status, and declines in a bunch of different areas of our residents' care. And it's the isolation. I guarantee it's the isolation and not being able to be around their loved ones. And so we're trying to figure out how we do that, stay compliant with all the rules, and not introduce any of the virus into our building any more than just would happen, I think, in other places or naturally. Other places got a lot worse than we do, and we're real fortunate and feel real blessed to be where we're at with that. But COVID-19, I don't see us. I don't see us getting out of this phase one, of reopening status. The state set up 3 levels of reopening: phase 1, 2, and 3, and it just doesn't seem like we're going to be advancing our reopening phase with the guidelines that are in place. So we're probably we're really trying to focus on how do we get people in touch with their loved ones and still keep everybody safe. So, and we've got some ideas on that, and we'll be working to implement those. We did have some improvement in our quality measures over June, so it was good to see that. We're pretty well narrowing down a lot of our quality measures is largely due to our documentation, not necessarily due to what's actually happening in our facility. So We're working on the documentation to make sure that what we're reporting is actually what happened, and we're shooting ourselves in our foot because, I mean, we're doing the right things, but we're not reporting it properly, and so we're not getting credit for it. So we've got to fix that. One of the things that we've really been pushing for improvement has been, over the past year, has been the reduction of our utilization of staffing agencies for our nurse aides. And in August, we had our first week without a bill to a staffing agency. So when I got there back in May of last year, and we were averaging $15,000 to $20,000 a week spent on agency nurse aides. And in the month of July, we spent under $7,000 for the whole month. So, and it's going to be even less in August. So, back when I was tracking it, back in October, was when I started tracking our total cost for direct care. So our staff plus our agency staff, we were spending about $125 per patient day. And in July, we had that down to our lowest number yet at $88.7 or $88.70. So I feel real good about that. And we're actually providing more care at that dollar amount. So it's the quality is going up. Steve talked about our COVID money, and we did receive from HHS $326,000, which some of that's funneled back to us already for lost revenue, and about 120 that's through June, right? Somewhere around there. 120,000 in lost revenue, and then another 20 or so in expenses related to COVID, and there'll be more for July and August. But our census is quite a bit less than it was a year ago. I took just a few minutes to look at some numbers, and for 2018-19 year, we billed out $3.95 million, and we collected $3.6 million for roughly 91% collections, and that left $360,000 uncollected. But for the 19-20 fiscal year, we billed out quite a bit less at $3.6 million, or $3,609,000, but we collected $3,581,000. So that's a 99% collection, and we went from not being able to collect $360,000 to only less than $30,000. So
Yay, good for you.
it was, the income statement always looked pretty good for the nursing home, but the cash wasn't coming in the door. And so I'm glad that we're getting that turned around. So
Yeah, that's made a big difference. It really has.
and there was a land sale today that should put another $120,000 into our cash, previously uncollectible.
Good job, Kelly.
Yeah, good job.
Kelly, you mentioned people haven't been able to be with their loved ones since back in March. Did you happen to see on TV the other day? It was on the news. Some nursing home had a hugging booth, and they set up something kind of like a shower curtain, and the resident had helped them in one side, the relative would come in the other side. There was a clear plastic sheet between them, and they could hug and talk and look at each other without actually touching. It was really neat.
Was it in
And you could
Oklahoma?
tell the residents were loving it. I don't think it was in Oklahoma. I didn't catch where it was from, but it was neat to watch because they were really loving it.
We've seen some neat stuff on, people share stuff on Facebook, and we're trying to implement some of those things. Right now we've kind of been distracted the last couple of weeks, but we've been wanting to have some stock tank fishing. So
Oh, yeah.
I saw that, that's cool.
go out and find some fish to bring into town and do some fishing, and the staff have a lot of creative ideas. It's just a matter of figuring out how we implement them and all that. So it's nice to see those stories. It'll be nicer when we're the ones telling them.
Yes.
Right.
I wonder if the college or the VOTEC couldn't help you pull some of that off.
Well, we're not allowed to have volunteers.
No, I don't mean in the building, but if you need something built.
Oh, yeah, yeah. I know someone that sells stock tanks that usually lets you borrow them too.
Yes, you can absolutely have some.
But, we are looking at door locks and replacing our code alert system with one system, hopefully. And so I'll be having some contractors on site to look at our facility and see what they can do to get us some quotes. But I'm hopeful that maybe we've got something to present to the board by the next board meeting. That's all I've got, but I'm happy to answer questions.
Any questions for Kelly? If not, Kelly, thank you, and that was all good news. Next item is the Homestead Report. Do we have a Homestead Report?
I don't have much of a report. Carla and I are still transitioning some things, and the reporting hasn't happened yet. So I think we're, like Steve said, with the finances, we'll probably have the July Homestead Report wrapped up by the end of this week, and then hopefully get on track for next month on schedule.
Is there a foundation report?
There's no foundation report.
Okay, no St. Anthony's report?
She said she would be here next month.
All right. Next time is City Council's report.
Yeah, just real quick, for the city, the sales tax had gone up. Our cash on hand is improving, which is good for the city and obviously good for the hospital then. A few things we did do at the meeting. We had a presentation for the Officer of the Year. We administered the oath of office to our new Fire Chief, Brian Miller. We also were allotted about $380,000 for CARES Money Act or CARES money for COVID. Trying to work out, what we can and cannot be reimbursed for, so we're working on that. We did approve an agreement between the City of Alva and the Board of County Commissioners for the 911 dispatch for the services for the city. And other than that, just nothing really related for the hospital. Be happy to answer any questions. We did finally approve our contract with our fire department, which was good to finally get off our plate. So,
Any questions for Bo? If not, Bo, thank you. So, one of the questions is if we could move our meetings to the last Tuesday, or the fourth Tuesday of
Fourth
the month.
Tuesday of the month. Currently, it's third Tuesday of the month. The reason I requested that, it just seems like, especially with COVID going on, there's so much to do. I have to report on COVID the use of the funds each month, so we have to go through the receipts, decide what's COVID, what isn't. Kim Baugh's been very helpful with that. Kelly's put a lot of time in over at the nursing home. Unfortunately, both of those people are very busy, and it just, you run out of time before you know it. It's third Tuesday of the month. So if we could postpone that a week, at least until COVID's over, maybe through the end of the year, that would certainly help us out on the financial side.
Does anybody have an issue with that?
You're just talking about temporarily,
Well,
just not having a regular meeting, just have a special meeting on
special
that.
meeting on the fourth Tuesday instead of the third Tuesday. Or, I guess we could, what would you have to do?
You have to change the charter.
Yeah, we don't want to go there. Can we just do it month by month? Is that what you would
Well, that's what we've been
That's
doing.
what we've been doing.
Right, so, I mean, I
We've been
didn't,
doing this since.
it's not really an issue, it's
Not
just that,
thinking into the future, just.
yeah. I wouldn't really
So don't we vote on so does the charter say the third Tuesday?
I'm gonna have to look and see, because, the city of Alva does.
Because we approve a
we're-
calendar every year, so if we wanted to change it on that, we could do that.
If it's just a calendar issue, but,
You might look and see.
yeah, I will. I'll look tomorrow.
Okay,
But can we move September?
so we'll make
Go
a,
ahead and move September.
we will move September to the fourth Tuesday.
That'd be September 22nd.
Oh. That's the fourth Tuesday?
Yeah, actually it is.
Yeah,
The
that's
first
why,
one-
that's why, the 15th.
First one's on the 1st.
Oh, okay, that Tuesday actually be all right.
8/15 and 22nd. Yeah.
Yeah.
Because I think it's the 21st is what I got, so I think that must be fine.
It is.
Huh?
It is.
Okay, yeah, we're fine.
Thank you, I appreciate that. Chris appreciates that.
Yeah, especially in those
Rosemary
months, because technically that's the third week, that's
Right.
just a pooper of a deal. But- Okay, I don't have any other items, there was no items of new business this time, and so we are adjourned.